Hello and welcome to my YouTube channel. Today we are going to talk about pancreatitis. First, let's understand what pancreatitis is. Pancreatitis is an inflammation of pancreas. It's explained by its word itself. So we can see the image of pancreas in the figure. A pancreas is a large glandular organ. It's located in the upper abdomen and it's located behind the stomach. It has endocrine and exocrine function. It produces hormone and digestive enzymes as well. Enzymes like amylase, lipase, protease are produced, which helps in digestion of our food, and the food which is digested gets absorbable. So it has a dual role. It produces insulin, glucagon, somatostatin, etc. So the pancreatitis compromise this function, so there can be different health problems in our body. Pancreatitis ranges from self-limiting mild pancreatitis to life-threatening necrotizing pancreatitis, which accounts for 10 to 20% of the total cases. It's actually the inflammation of the pancreas, which is usually caused by premature activation of digestive enzymes. It is usually caused by idiopathic causes as well as other causes. We will see about the most probable causes of pancreatitis. The causes include alcoholism, chronic alcoholism, or a person is severely alcoholic, and if a person has gallstones. We just saw the image of the pancreas and we saw gallbladder too, and it's connected through the same duct, and the secretion is passed to the duodenum. So the gallstones can impact and cause inflammation of the pancreas. Viral infections, history of pancreatitis in the family, huge amount of cholesterol, that is usually more than 1000 mg per dl, hypercalcemia, different kind of drugs, and trauma, bee sting, or any other toxic substances can also possibly cause pancreatitis. Now we talk about the major clinical features. Clinical features include epigastric pain, as it is the problem that is seen in gastrointestinal system. We can see nausea, vomiting as well. The person is at a high risk of pancreatitis if he has a history of chronic alcoholism, if he has had gallstone disease, or a person is obese who has high amount of cholesterol, and if he has faced any kind of metabolic abnormalities in the previous history. So hypertension, fever, the patient looks toxic, tachycardia, tachypnea, gray Turner, and Cullen sign. These two signs can be observed in the flank and the umbilicus. We can see these signs. Gray Turner signs, it's actually the bluish discoloration on the flank. It's usually seen in the severe cases, but it might not be noticeable in the acute cases without complication. Cullen sign is the bluish discoloration in the periumbilical region. We can remember this sign by the letters CU, and we can remember the name Cullen's, and we can remember it by remembering the second letter of the word U, and it's affected in umbilical region. For Gray Turner sign, GF in the flank, so gray and flank, we can remember that way. We talked about the definition as well as causes and clinical features. Now we talk about the diagnosis of the pancreatitis. We usually check for total count with differential count. We can see the increase in neutrophil amount. Serum amylase and serum lipase are increased, so it usually increases for more than 3 folds of normal value. We can do UHC abdomen. We can see the edema and necrosis of the pancreas in the USG. We can do CT scan too, chest X-ray to rule out systemic complication like acute respiratory distress syndrome. It is also necessary to ensure that the problem is not only in the pancreas, or there might be other problems in other parts of the body. Now we talk about the treatment. The treatment is usually started through nil per oral. We don't give anything by mouth to the patient, because if we have to do immediate surgery, the patient may face aspiration diseases, aspiration problem like aspiration pneumonia. We have to provide IV fluid infusion to reduce the risk of dehydration. We can provide Ringel's lactate as a fluid of choice. The patient might have severe pain, so we can manage the pain according to the severity. We can provide NSAIDs like paracetamol, or if a patient has very high pain, we can give morphine, pethidine, etc. We have to provide oxygen therapy if a patient has a breathing problems, or if a patient is not able to breathe properly. We can provide the fluid balance too, and we can monitor the urination. We can monitor the patient's vitals. We have to care about the nutritional support too. We can do gradual refeeding. We have to start oral fluid once pain decreases and bowel sound returns. We can do NG feeding, and we have to take care of the secondary causes too. We have to manage the secondary causes, and after these general management measures, if the patient has low symptoms and if the patient relieves, we can discharge the patient or observe for a few hours. But if the patient doesn't decrease or the condition worsens, we have to um, do surgery, and we have to manage the secondary cases according to the underlying causes. If there is any offending drug, we have to stop the drug, and the person should stop consuming alcohol as well. And the gallstone, if the problems is from gallstone, we can remove the gallstone, and we will definitely talk about the gallstones too in the future video. For today, thank you for watching. Subscribe.